Hi and welcome to CodeQuarters.
Here at CodeQuarters, we provide you with useful information and test techniques to help you pass your U.S. Medical Coding Credentialing Exam. These U.S. Medical Coding Credentialing Exams, by and large, field multiple choice questions, and are timed.
As such, there are very specific techniques and skills that you need to pick up, and then employ, in order to better your chances of passing the medical coding exam which you intend to take.
It is the intent of this video series to do just that. Coupled with enough effort on your part, there is absolutely no reason why you should not pass the credentialing exam, and earn for yourself that much desired medical coding certification.
Here is today's question.
An 11-year-old female shows up to the doctor's office with 2 dark lesions and a skin tag on her back. The 2 lesions on her right upper back are punch biopsied. The skin tag on her back is removed by electrocauterization. What CPT code or codes should be reported? Here are the letter choices. Letter A, 11,104, 11,200-59, and 11,201.
Letter B, 11,104, 11,105, and 11,200-59.
Letter C, 11,056, and 11,200-59.
Letter D, 11,104 times 2, and 11,200-59. What CPT code or codes should be reported? You can now hit the pause button to give yourself time to solve the question.
Once you have your best answer, you can hit the play button to see the solution to today's question. Go ahead.
Were you able to get to the correct answer in the most efficient way? Let us check on your answer, and even more important, your method to get to that correct answer.
In the question, there are 2 conditions that brought the patient to the doctor's office: the 2 dark lesions and the skin tag, all found on the patient's back. For the 2 lesions found in the patient's upper back, these were punch biopsied by the doctor. On the other hand, the skin tag, also found on the patient's back, was treated by electrocauterization.
Take a look at the available letter choices. Remind yourself that the first code is the most important code, and is the best place to start working towards the correct answer. Remember this tip.
First code first.
From among the choices, we see that the primary procedure, the first code, is a choice between 11,104 and 11,056. In the CPT manual, 11,104 is described as punch biopsy of skin for a single lesion.
11,056 on the other hand is described as paring or cutting of benign hyperkeratotic lesion.
In the question, we are not able to find any reference to, or mention of, either a paring or a cutting procedure. As such, 11,056 cannot be reported.
Therefore, first to go, is letter C. The primary procedure for this question is 11,104, which is punch biopsy of skin for a single lesion. All of the remaining letter answers, A, B, and D, have 11,104 as their primary procedure.
Remember, we are reporting for 2 lesions that were punch biopsied. In the CPT manual, 11,104 is paired up with 11,105. 11,104 is used to report work on the first lesion. The add-on code 11105 is used to report for each separate or additional lesion.
With that being the case, letter D is an incorrect way of reporting lesion biopsies. If there is a second lesion or more lesions that were treated, simply multiplying 11,104 with the extra number of lesions is the incorrect way of reporting. Therefore, letter D is taken out.
This leaves us with only 2 letter choices, letter A or letter B. Letter A has us reporting only a single lesion treated courtesy of the code 11104. This would be incorrect because, as we have just pointed out, there were actually 2 lesions that were treated with punch biopsy. As such, letter A is last to go.
The correct answer to this question, by method of elimination, is letter B. We are reporting 11,104, 11,105, and 11,200-59. Did you find our video tutorial helpful? If so, hit like and subscribe to this channel so you can get notified every time we release new videos.
If you have friends who are also studying for their U.S. Medical Coding Credentialing Exam, let them know about this channel by clicking the share button.
Thank you for spending your time with us here at CodeQuarters. See you next time.
See you next time.